Clearly, we view universal health care as the most cost-effective, most efficient, and most humane way to pay for health care. And my comments today are heavily going to focus on the humane part, because history shows us in the United States major civil rights movements, major social change is done when we touch people's heart, not when we debate a lot of mechanics and cost issues. Heart produces the change. What we're looking for is a system that promotes a not-for-profit healthcare financing system in the state or at the state or national level, pays for comprehensive, high-quality, affordable healthcare services for everyone. It seems so straightforward. The only system that we believe meets all of those criteria today is improved Medicare for all. And I want to just pause and go back to terminology, some of which Irene touched on. But we're at a point today in this movement where we can be confused between universal health care, single payer, and Medicare for all. Coming into the room, can I just see a show of hands if others have wondered what's one versus the other? Yeah. Improved Medicare for all is a form of a single payer healthcare financing system that results in universal health care. And today, we should, in our opinion, we should be using the phrase improved Medicare for all because healthcare, universal health care has become too generic and too many people hide behind it without really saying how they're going to get there. What's the foundation doing, both in 2017 and 2018? Well, think of this, realize also that this is your basic grassroots movement. Like every other social change movement, like every other civil rights movement in our country, it's grassroots. It's meetings like this, and hundreds more of them. We can work together. This is what the foundation's doing, but see yourself on these slides as well. Coalition building is huge. We want, we would ask you to think about what organizations are you involved with in Greeley and Weld County at the state where your members are suffering because of how we handle health care. With a little more education, could you get that organization to endorse improved Medicare for all? Because as this escalates, we'll want more and more organizations where their names out there saying we're behind this. It's a big part of the movement. Educating the public, social media, letters to the editor, public speaking. Again, think of yourself. Virtually everyone has some involvement with social media. Almost anyone can write a letter to the editor. And as Irene mentioned, the stories we need to tell are the personal ones. I would encourage you to avoid screaming at each other with political sound bites. Just tell the story from the heart, how your family's being impacted by this cruel system we've got today. Educating elected officials and candidates. And thank you for being here today, sir. This is really important. And again, be specific. Ask them where they stand on improved Medicare for all, not do you believe in universal health care. For folks running for office, it's too easy to hide behind that and say, of course I believe in that, but we'll keep fiddling with the insurance industries over here and see if we can make it happen. It's not the same thing. We support state and federal legislation that moves us in that direction. And advocacy. To a great extent, we are representing you in the voice at the state level and at the national level. We we advocate when it's time for rallies. We sponsor conferences throughout the state on the subject of improved Medicare for all and universal health care. We also attend nationally. We interact with other organizations in other states that are doing the same thing. We stay close with Senator Sanders' office. So, as has been mentioned earlier, what we have today is literally morally bankrupt. The crushing medical bills, the prescription drug bills, even for people who have insurance. And as the other speakers have mentioned, you don't think about that if you're living in another country. The idea that you might have to trade off the cost of medicine or seeing the doctor with food. The thought that you might actually go bankrupt because you can't pay your health care bills. It's a foreign thought. It doesn't even cross their mind that that's a possibility. Why would we allow that to be happening in our country? Those stories about the crushing costs are really important. People are reluctant to share those because they're embarrassed or they feel uncomfortable. But it's really important that the stories get shared. And it's not just those crushing medical bills. Think how our current financing system for healthcare undermines so many other things we value in our country. Everyone knows someone who says, the only reason I'm still in this job is because of the healthcare benefits. It's not good for the person, it's not good for the company, and it's not good for society. Taking care of our elderly parents. The person who says, I'd love to cut back to part-time so I can really help with my elderly parents, but I can't, I'll lose my health care benefits. Same situation for the couple who says, one or both of us would like to cut back so we can have more at-home daycare, take care of our kids, instead of farming that out. Sorry, can't do that. If I cut back to part-time, I lose my health care benefits. And these are the things we say are important in our society, and then we put up a major roadblock to not allow it to happen. We put profit over people's freedom to choose a medical provider. Throughout this discussion of health care, there's always this very top issue. I want to pick my doctors. I want that kind of freedom and control. Absolutely. And then we interject this absolutely goofy and absolutely unnecessary feature called in-network versus out-of-network. And it changes from time to time. It's just nuts. Lastly, it discourages people from getting married. If you're a young couple today, or a couple of any age, you're going to do the math before you get married. Did we just put ourselves in a different income category and now we're going to lose the subsidy we're getting from the Affordable Care Act? Will one of us no longer be eligible for Medicaid, the program for low-income residents? So look at these and the other ways our current system undermines what we value as a society and ask the question, is this the country we want to live in? Why would we continue to accept this as okay and it's just the norm and we'll fiddle with it and hope it gets better? Look what it does to our economy. I talk to numerous small business owners and those who can't afford to offer a meaningful health care package. They say, I know as soon as I've got a good employee trained and up and working, within 6 months to a year they'll be gone because they're constantly looking for another job that has better health care benefits. It hurts the small businesses we say we love. Secondly, it's a major drain on profitability, whether it's the turnover cost at small businesses or the high cost of insurance for the major corporations. That 6.7% comparison for employers, major employers spend between 11 and 15% of payroll to cover the health care costs today. There's a potential for some great savings. We always talk about how much it costs us compared to what it costs overseas. There was a report years ago where General Motors used to say, I started at $2,000 per car disadvantage because that's the cost of health care I have to build into every car compared to other countries. A major cause of personal bankruptcies. Think of the ripple effect. If I go bankrupt, how many other people, organizations lose financially, and just all of the time and effort we put into society when hundreds and hundreds of thousands of people go bankrupt due to medical bills. What an absolute waste, but we keep putting up with it. We talk about the advantage, how important it is to get those entrepreneurs the chance to get their bright ideas out and working for us. And then we put up this major roadblock when they say, I can't leave my current job, I'll lose health care benefits. And last but not least, our current financing system inflicts huge financial and social costs on our society because we are incapable or choose not to really provide access to meaningful mental health care. We read about the big issues week to week, the next shooting from someone who's suffering with mental health issues, but 1 in 4 of us deal with mental health issues during the course of our lives. And we virtually abandoned that in terms of funding meaningful mental health care. What we have is morally bankrupt, it's a drain on our economy, and it's an attack on our families. Why would we continue to accept this as okay? This model that's driven by, are we paying insurance companies enough? Think of this as we have every other major civil rights issue in our country. The first question is always answer the moral question. And with due respect to folks in the audience, a lot of these detailed questions about can we fiddle with this, can we fiddle with that? It's the wrong question. The right question from the beginning is, what's the morally correct thing to do? And when we decide to go in that direction instead of fiddling over here in this direction, we're smart enough to figure out the details. We've done it before, numerous times. The creation of Medicare was fought enormously. That was not an easy sale. Think of what we went through as a country with the civil rights movement, the movement for women's equal rights. Once we made the moral decision, we were able to figure it out. We've done it before, and we can do it again. From the foundation standpoint, improved Medicare for all is the only option on the table that gets us going in the right direction and takes the insurance industry and the pharmaceutical industries out of the driver's seat. So thank you very much. And I'd ask you, if you are so inclined, please go to our website, not the least of which is to get some information that might be helpful. But we're heavily volunteer-oriented. Consider a donation if at all possible. It's couniversalhealth.org. couniversalhealth.org. Thank you very much. So the question, if I can paraphrase, was for those who say we really need market conditions to work, and we should keep moving in that direction, I think there are a couple of answers. The first one is, how many more decades do you need? We continue to hold on to this flawed model that somehow healthcare, and one of the other panelists mentioned it, that somehow healthcare is like buying a refrigerator, where the buyer and seller both have enough information to work collectively with each other. It's not the same situation. It's not a free market issue. Simply doesn't work. Yeah, the question was, if you go to universal health care, all those people who sell insurance will be out of a job. Yes. I'd like to answer that from a free market perspective. There was an article written by the American Enterprise Institute in 2015. The title of it was Fortune 500 Companies, 1965 to 2013. 85% of them are gone, and we're better off because of it. This is not new. We've seen industry after industry rise and drop off and disappear when it's been clear that they're no longer adding any value, that the service or the product they're selling isn't needed anymore. Now, if you're one of those individuals who's going to lose your job, yes, we understand that's a concern. And there should perhaps be help in transitioning those folks. But for the people that are losing their job pushing paper in insurance offices, we're going to be creating jobs of nurses, doctors, and technicians providing health care to people who aren't getting it today. The overall impact on employment would be nominal over the course of 4, 5, or 6 years.